Hi, I'm Dr. Seema Sharma. I'm a senior consultant ops in gynae working at Apollo Cradle, Amritsar. I'm gynae laparoscopic surgeon as well and doing all kind of laparoscopy for gynecological conditions. Today I'm going to speak on endometriosis. What is endometriosis? It's a painful pelvic condition, and to understand endometriosis, first you have to understand what is endometrium. Endometrium is the inner lining of the uterus, and normally it is shed during menstruation every month, and it goes out of the genitalia. But in case these endometrial cells develop outside the uterus in ovaries, fallopian tubes, it leads to the condition endometriosis, and which is very painful. And what are the main sites for this endometriosis? Endometriosis generally is present in ovaries, fallopian tubes, and tissues around the tissues and organ around the uterus in the pelvic area. And what are the main causes can be exact cause of this disease is generally not known, and it varies from person to person, but there are certain factors which promote this disease. It can be like hereditary, and it has been seen if some of the patient's relative is suffering from endometriosis, the patient is more likely to have endometriosis herself. And it has been seen that identical twins, they always share this disease, so it has a hereditary basis. Second most important reason can be factor which promotes endometriosis is retrograde menstruation. In retrograde menstruation, what happens, the normally shed endometrium out of the genitalia is not there. There is reverse flow of menstrual blood towards the pelvic cavity, and the endometrium goes into pelvic cavity, and endometrial glands starts proliferating in the pelvic cavity over the ovaries, over the tubes in the pelvic area, and leads to endometriosis. And third is it can be some metaplastic changes, that normal tissues, they start developing endometrium, leading to endometriosis. And now coming to symptoms, what all symptoms are there when patients suffer from endometriosis. First and most debilitating symptom is pain. There is normally in periods, patient feels the pain during first or second day of the periods, but in this condition pain is there which starts from before the period start, and it lasts after the period also. And as the time passes, these patients have pain throughout the cycle, and this is quite disturbing and distressing symptom. Second most common symptom seen in these patients is menstrual irregularities. These can be in the form of heavy periods. Periods duration is more, and these can be intermenstrual bleeding, or sometimes pre-menstrual spotting and post-menstrual spotting is also seen. And last but not the least is patients, they are very difficult patient for conception point of view. They are unable to conceive, and this is very disturbing for the patients who are not conceiving despite every effort being done. And reason for infertility is because these patients, in this condition, there is lot of adhesion formation and scarring inside the pelvic cavity, and patient is never is not able to ovulate properly because of thickened ovaries, cysts in the ovaries. They don't ovulate. By ovulation we mean that they don't release the eggs properly. So egg formation is defective in this patient. Release of egg is difficult in these patients, and then the pickup of the eggs by the tubes, fallopian tube, is also difficult in these patients because of lot of scarring and adhesions in this area. So that makes the pregnancy to happen is a great challenge in these patients. So how to deal with these patients is also a challenge. There are lot of modalities to diagnose this disease. First of all, from the history of patient, we come to know there is some serious problem inside the pelvic cavity, and then ultrasonography, MRI of pelvis, and in some cases laparoscopy is also needed to diagnose this condition. And once this condition is diagnosed, then we have to treat it. There is no permanent cure of endometriosis, but we can easily relieve the symptoms of this debilitating disease with the help of some dietary modification, exercise, and some hormonal treatment in the form of oral contraceptive pill or progesterones. Symptoms are relieved, and in patients who are willing for the pregnancies or who want pregnancies, in those patients we have to do the clearance surgically, laparoscopically. We clear the pelvic cavity, remove the cysts, release the tubes from the uterus or ovaries, and then clearance is done, and after that patient is prepared for either intrauterine inseminations if the tubes are patent, or in case the tubes are not patent, we can prepare the patient for in vitro fertilization, that is IVF. So if it is not that the treatment is not there for this disease, but we need to identify the disease early and identify the symptoms, and timely management helps to control this disease, and pregnancy make the patient helps in the getting the pregnancies also. So this is a very much treatable disease if timely intervention is done. Thank you very much.